Hello everyone, welcome to PHTV Channel 4 in Palos Heights. I'm Sue Jankowski. Welcome to Meet with Moraine. This is exciting today because we are actually at Moraine again. We were here last month when we did maybe 2 months ago, we did our visit to the new Wellness and Fitness Center. And now we're back and we have a new guest here today. It is Mary Therese Galka. She is the Basic Nurse Assistance Training Program Coordinator. That's a huge mouthful. But explain exactly what you do, Mary Therese.
Well, I am a full-time nursing faculty, and I teach in the Basic Nurse Assistant Training Program, or possibly better known as the Certified Nursing Assistant Program. We take students, beginning level students, that come in and have an interest in healthcare and are interested in becoming assistants in the healthcare setting to nurses and the members of the healthcare team. They take this course sometimes to determine whether they want to go on in a healthcare career or become a registered nurse. Others take the program because it is a requirement for nursing courses throughout the state of Illinois and the surrounding states. And others take this program because they're interested in providing care to the elderly, the sick, the debilitated, and it's just their calling in life. Usually people that come into a field like this do have an interest in providing care for people. They care, they're kind, they're hardworking, and the students that come into the program come from all different walks of life and age levels, male and female, and they all seem to do well and enjoy the course.
Well, I think anybody who's had any kind of friend, family, or yourself in a hospital situation or in even an at-home nursing facility, whatever, has had a certified nursing assistant do so much for them. And I think even more than ever, that is super important because we do have those people helping us. They have to be trained and they want to be excellent and get a great job. And this is a great starting off place. Or maybe this is the training they need to do the job that they want to do in the future.
Absolutely. Since the year 1987, the state of Illinois and, well, actually the federal government came up with a rule or a law that every nurse's aide in any healthcare setting have to be certified and have to attend a formal, approved training program. So here at Moraine Valley, we offer the Basic Nurse Assistant Training Program as a 7 college credit hour course, and it is approved by the Illinois Department of Public Health. And upon completion, the students have the capability, the ability, the training to be able to perform patient care skills under the supervision of a nurse. They do take a written state exam to become certified. They actually have a certificate in hand that qualifies them to practice, as Sue said, at the bedside, in a home health setting, wherever people need help, the nurses' aides are there to provide that care.
And more, I feel like people are in and out of the hospital so quickly where they could be employed, but also outside in your own home, the requirement for healthcare workers must be really skyrocketing because there's so many people that are having that short stay in the hospital and then they need additional support at home. And I imagine a lot of these people who are in training now will go on to do something like that.
Absolutely. Because of the aging population, in the years to come, there will be more and more need for nurses' aides and also, of course, registered nurses as well. And our nurses' aides do find jobs. They work in long-term care facilities, which we might call nursing homes, also at the bedside in hospitals, and many times, as you said, Sue, in home health settings, taking care of those patients that came home from the hospital but still need additional help.
Exactly.
And it's the nurses' aides that provide that help at home.
That's right. And so now this whole course to get certified is how long?
Well, we offer the course either as a 10-week course or a 17-week course. Of course, the 10-week course is much more intense and fast-paced, whereas the 17-week course is just like a college semester. It consists of 144 hours, so the students do put in a considerable amount of time. 68 hours are in a classroom, so they're receiving information about healthcare and concepts and theory and disease processes. They also come into a lab, which they practice skills day after day for 36 hours, 9 4-hour sessions or close to that. And then eventually, toward the end of the course, they do go to healthcare settings and they actually take care of patients. So they have the opportunity to go to a hospital or a long-term care facility that's in the area. So examples of some of those facilities might be, let's see, we have Little Company of Mary Hospital, Ingalls Hospital, which is in Harvey. We also go to long-term care facilities like Manor Care East, which is here in Palos Heights, as well as Holy Family Villa, Franciscan Village, which is in Lamont. We go out to Orland to Smith Village, Smith Crossing, and Alden and Smith Village, which is in Chicago. So students do practice their skills and have the opportunity to work at the bedside in any of these facilities.
Well, that's so important too. It's nice to get the training here and then actually use the training and feel like comfortable and confident once you are in that job market that you have the skills that you need. So really, you must have like quite a few. I mean, this is such a wonderful program. You must have quite a few students kind of come through your program.
We do. We offer approximately 6 to 7, which educates about 120 to 140 students every semester. Most students are very successful in the program, and when they take the state certification exam, we have over a 95% pass rate. So we have really good statistics in the state. I just attended a conference down in Springfield about 2 months ago, and we were one of the only programs that wasn't in jeopardy. We didn't have to put in a plan of correction. We have all positive outcomes, and I was pretty proud of that.
You should be, because it is very difficult to get to the point where you're not in jeopardy or they're not really scrutinizing you. So you've got a really great program if you can pass muster that way.
And we do have approximately 28 instructors. They are all registered nurses. Many of them have had many, many years of experience in hospital settings, surgical settings, outpatient settings, and they choose to further their career by coming here and teaching nurses' aides how to be the nurses' aide that they once were when they were young and just starting out.
Right. Well, that is fantastic. Well, we're going to stop and we're going to just kind of actually see what do the students actually learn. I think that'll be really interesting. A lot of people want a second career. A lot of people are just curious, like, what do those nurses' assistants learn that I will be the beneficiary of at some point? So we're going to find out right now.
So here we are in the nursing lab at Moraine Valley on the college campus, and we have two students here, Brianna and Brittany, who are practicing, demonstrating how to give a patient a bed bath. And so that is one of the skills that we teach here in the CNA program, one of the required skills for a certified nursing assistant. And they're learning all the principles that they need. As you can see, they're wearing gloves so they understand the infection control precautions. In addition to providing a patient or giving a patient a bed bath, we also teach the students how to give showers and tub baths as well. One other thing we do is we practice combing their hair, providing oral care, which means brushing their teeth or their dentures, as well as nail care, and in our males, shaving. So those are some of the skills that are taught in the Certified Nursing Assistant program. And I can see that the girls here are doing an excellent job. Practice makes perfect, so they'll be ready to go to clinical, which starts in a week. So here we find students who are practicing putting on gowns and taking off gowns as part of personal protective equipment. We all know how important it is for infection control in this day and age, and the students are taught from the very first day how to properly wash their hands, how to put on isolation gowns, which we can see them doing right now, masks as well, goggles, head covering, foot covering. In addition, they're taught how to bag up infectious material to send it down to the lab for evaluation. Students seem to be doing a really good job here helping each other out because it is such an important part of healthcare. Let's see what's next. Okay, at this station, we find Kathy Sturl, who is one of our certified nursing assistant instructors, teaching, showing, and evaluating students as they measure each other's height and weight, which are also taught in this program, very important and critical in healthcare. So students practice these skills here in the lab day after day until they have perfected them, and they will be prepared then to go to the clinical setting and take care of a patient, to provide their height, to get their weight, to provide those measurements to the nursing staff, to the physician for evaluation. So it looks to me like the students are doing a pretty good job here. We've got Taylor and Brittany weighing each other and measuring height over there. And with a little practice, I'm sure they will be proficient at that. Students are gathered here at this table to practice taking vital signs on each other. Vital signs include taking a person's blood pressure, their pulse, their respiration, and their temperature. So students do require quite a bit of practice before they go to the clinical setting to ensure their accuracy. Each student is guided by their instructor and then evaluated for their efficiency in the procedure and, of course, their accuracy. Hopefully everyone here has a blood pressure of about 120/80 within the normal ranges, but practice makes perfect once again, and students work very hard at these skills. In addition to some of the skills that we've mentioned here today, the nurse's aide students also learn such skills as transferring a patient from the bed into a wheelchair, or let's say from the wheelchair onto the toilet. Those are some of the skills that we do practice, frequently done in clinical. We also teach students how to exercise patients' arms and legs when they are in bed and they are immobile, and they need the exercise to keep their muscles in strength. We also teach students to walk with patients, either with a cane or a walker. There are so many things and so many skills that are taught in this Certified Nursing Assistant program that when these students finish this course, they are well prepared to take care of you, your loved ones, your family members, your neighbors, anyone who has any kind of healthcare need.
Thank you so much for that tour. It was absolutely fascinating. It's great to know that they are going to be so well prepared and they just practice these skills until they really know them really well. I'm thinking that you could get a whole bunch more people coming in here. What should they do if they want to be part of this program and learn how to be a certified assistant?
Well, in order to take this Certified Nursing Assistant program or the Basic Nurse Assistant Training Program at Moraine Valley, you do need to be 17 years of age.
Okay.
You need to have a valid Social Security number. In addition, you have to have a 9th grade reading level. So those are the 3 requirements in order to take the class. As I said before, it is a 7 credit hour class, and the call number is HSC 150, and you can simply register. If you've been a student at Moraine Valley before, you can register online. But of course, you can also come into the college and just register for the class. We do offer the program in the spring semester, the fall semester, and also during the summer. So it does go all year round.
It does. What if you're just a little unsure? I don't know if this is what I want to do. Is there someone they can come in and talk to?
Absolutely. Anyone who would like to call me, they certainly could call me, and I could talk to them on the phone or email me. Plus, on the Moraine Valley website, there is a tremendous amount of information, including frequently asked questions. So, that is something that's worth looking into. Like I said before, students seem to really enjoy this course because it's a combination of learning things that they can use throughout their life in addition to practicing skills and then actually getting up and doing something that makes a difference in other people's lives.
Exactly. Well, thank you so much for the really interesting tour. It's a phenomenal program, and it's good to know that it's here. Mm-hmm. But I didn't realize all that. So thanks for watching us. We'll see you next time on Meet with Moraine. Bye-bye.
Thank you.